Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about SIBO, or small intestinal bowel overgrowth. What are the clinical pearls for SIBO, right? Small intestinal bowel overgrowth. So what is SIBO, right? Basically, you have bacteria that's abundant in the large intestine that sneak into the small intestine and overgrows, right? That's basic definition of SIBO. Sometimes it can be an issue of a ileocecal valve, the valve that keeps things from flowing backwards from the large intestine to the small intestine and creating overgrowth. So there can be dysfunction of the ileocecal valve. When we look at SIBO, the basic medical treatment is something called Rifaximin, right? It's an antibiotic that can be used, and you have to go through between 2 and 3 weeks of antibiotic care, right? The cost for that is about $1,500. That's what the insurance companies will be billed, and if you have a deductible, or sometimes they won't cover this type of antibiotic, you're stuck with a $1,500 bill, right? So in the traditional medical model, they'll give you Rifaximin, but they give you no dietary recommendation, right? This is problematic because SIBO is recurring, right? So you can knock down the overgrowth. However, if you don't change your lifestyle and dietary habits, it can come back. Then you're in for a second round of Rifaximin. It's problematic, right? So the best way to test for SIBO is a breath test. There's something called a lactulose or glucose test, where you drink a solution and they check for 2 different gases. One is hydrogen and one is methane, right? Methane gases typically, not always, but typically will cause constipation. Hydrogen gases typically will cause diarrhea. Some people will come in and have a mixed bag, alternating diarrhea and constipation, right? And they may have both gases that are elevated during the testing. Now, methane and hydrogen are not the only 2 types of gases. So if you basically have bloating, your stomach swells to the point where you feel like you're almost pregnant during the end of the day or after meals, you likely have SIBO. And SIBO is the #1 cause for irritable bowel disorders, right? When they say you have IBS, IBS is just a basket term, right? The #1 cause really is SIBO, or small intestinal bowel overgrowth, dysfunction in the GI tract. So in the traditional model, that's what we're looking at. In the nutrition model, we like to do is change the dietary habits, right? Anti-inflammatory type of diet, reduction in carbohydrates, typically all grains, fermented foods sometimes be problematic, alcohol, starchy veggies, legumes. We typically will recommend in the initial phases a FODMAP diet. So FODMAP diet is very specific, and it reduces these food items that cause bloating in a lot of the SIBO patients. So you can go ahead and Google FODMAP diet. Now, we have to be cautious about using a FODMAP diet because it's restrictive. And we do not want to put a patient on a restrictive diet forever. If you put a patient on a restrictive diet, it's very difficult for them to add foods later on because they feel like they have a food reaction. Or they come in, they go, I can eat only 12 types of foods, everything else makes me bloat. So we do not want to be too restrictive for too long a period. But certainly a dietary change is necessary in order for patients to have long-term benefits. SIBO patients in our office can be very easy or very difficult because it can be recurring. Other factors, not just food, can play a role in this, right? People who have concussions, one of the first things that can happen is it can create leaky gut. A brain injury will impact the vagal system of your GI tract and cause dysbiosis and dysfunction and SIBO in a lot of them, right? So you have GI issues as a result of a concussion. Chronic stress can also create SIBO-like symptoms. So people can recover, they go through another stressful time in their life, and SIBO will return. So it can be recurrent. However, with functional medicine or nutrition, it's much more affordable than the $1,500, right? So what we do is we take patients on a FODMAP diet, or more of a SIBO-specific diet, right? Eliminating some things. And then we will go after it with herbal remedies. Herbal remedies can be things like oil of oregano. It can be a combination herbal packet, right? But the important thing, or a clinical pearl, is not to use the same herbal product to kill off the overgrowth, but maybe rotate them every 2 to 3 weeks. So it has a chance, so the bacteria doesn't have a chance to adapt. So you rotate these herbal remedies, and then you have to support the GI tract. You can't just go, we're gonna just kill off bacteria. You need to support it, right? You may need nutrition that's good for the gut, right? So GI support is necessary when you have an herbal remedy for SIBO. So those are your clinical pearls, right? You want to be able to change the diet temporarily, not long term, and then kill off the overgrowth, sometimes affecting the ileocecal valve. I will go ahead and Google that and say ileocecal valve massage or release. That can help make the tone of the valve there a little stronger so it doesn't have the reflux back into the small intestine. So this little protocol can help quite a number of patients. Not all of them. Those patients we need to see in office and do more aggressive type therapies. But this is a simple way to see if it will help. All right. My name is Dr. Jin Sung, where clinical excellence meets excellent results. And we'll see you guys next week on the healthy side. Have an awesome